Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my very inquisitive co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
Yes.
Dr. Martin, I hear you are a fan of Reddit.
I love it. I love Reddit.
Love Reddit. Love some deep dives.
And I like Reddit for all the weird kind of sciencey tech stuff that I like. I mean,
I would maybe preface that with science and tech before weird. Because if you just say weird, I love weird Reddit. Oh.
Yeah, there is some weird Reddit. Yeah.
Yes.
Maybe weird was the wrong word.
Yeah, I think weird was the wrong word.
Pedantic, detailed.
There you go. Pedantic.
Technology.
Yes.
Technology. But I preferentially go on Reddit for a lot of things. And a lot of people don't do that. It's really interesting. You'll meet someone who likes Reddit and it's like a bond. Like, oh yeah, you look at these weird
pedantic
Reddit streams. And you get in there. So yeah, I think it's a great resource if you want to get something that's crowdsourced.
So what brought this up, if you go back and listen to our episode about things I wish I knew before having a rhinoplasty, I wrote that. And then I started thinking, I'm like, I wonder what Reddit says about what they wish they knew about having a tummy tuck, because tummy tucks, we actually were guests on a podcast that doesn't exist anymore. It was called She Gonna Say It, where they talked to us about tummy tucks because they both had a tummy tuck. And just the funny things that people think about tummy tucks or the things they don't know. She found us through the Swell Hell group. So this is what got me to deep diving Reddit. And I was blown away. I loved it. Really great stuff. Some chaos, of course, because it's the internet and it's people and it's Reddit. But
yeah, internet, people,
Reddit
means chaos.
Yep.
And throw Reddit in there too.
Yeah.
So you got to pilfer through some stuff.
So I love these. I'm not going to reference who wrote these comments just because you didn't leave these comments on our post. So I don't want to, blast people on the internet. But if you would like to have your question answered, we answered a bunch of questions in our previous 2 episodes. Leave us a comment. You can find all of our social media handles right here. And you can also leave me a voicemail or send me a text at 303-630-9038. Without further ado, you guys ready to deep dive Reddit with me about tummy tucks?
Yes.
Oh, I love this. Okay. So, things will feel strange. This is the category. I feel like this is almost like Jeopardy. Things will feel strange.
What is standing and sneezing, Alex, for 100?
Itchy, sharp pains for 3,000. Pain, numbness, etc. for a while. So, these were the things that go in this category. Dr. Martin said one of them, standing, sneezing, and back pain.
Oh, sneezing for sure.
She said that you can't stand up straight for days to weeks, depending on how you heal. Sneezing is the worst thing to experience. I'm almost 6 weeks post-op, and it still hurts like hell.
Because so real quick, because most of the time you do a diastasis repair, muscle splitting repair, and when you sneeze, you flex your core muscles. I mean, that's how you sneeze.
Yeah, even just the incision.
Yeah.
The back pain is the worst. Make sure to ice your back as soon as you can. And why is the back pain the worst? Well, for 2 reasons.
Compensation, number 1.
And lipo.
And lipo, number 2. Yeah.
Yes.
And the compensation is a big part of it because you're hunched over. That's not a ergonomic position.
No, it's putting pressure on your lumbar spine. You're kind of in this hunched position. You're walking out like a C curve in your back, and that hurts. How straight, cannot stand up straight. Now, we have our patients. Yes, you want to protect the area. However, we don't want our patients to be in like a little old lady in a shoe kind of thing, which is what people think they need to do. What I tell people is you can stand as straight as is comfortable without putting any tension on the incision.
Right.
So you may be able to stand straighter than you think, but you also will definitely not be standing straight.
Yeah, you can't stand straight because we pull pretty tight.
Yeah.
But it's like a 5% over. It's not a lot. Yeah. It's not a huge degree. You're not bent over. Mm-hmm. And I think that's a misnomer and also probably not good for you.
Not good for your back.
You're not going to be able to walk as much. The concern after tummy tucks is DVT, deep vein thrombosis. You're not walking. That's a higher incidence of blood clots. So, when you're hunched over, it's hard to walk like that. So you want to be as upright as you can without it causing severe pain or stretchiness.
Yeah, or just that feeling of pulling on the incision line. You also brought up, or I brought up itchy, sharp pains. So let's go there next. Itchy, sharp pains. You will get super itchy and you will feel little sharp pains in 3 to 4 weeks. They say it's your nerves and all that stuff. They are separated at getting back together. Watch our episode on nerves.
Yeah.
But yes, I mean, this is so common. Like people will say, it feels like I have pins and needles, or I'll get like these, I call them zingers or stingers. Like I feel like I'm being stung by a bee all of a sudden, ooh.
So real quick on this before So number 1, when you're healing and your scar is maturing, you'll definitely get these tingliness, some shooty pain and stuff like that. But what they're not telling you is in most cases, people put big sutures in the deep layer to keep things together. That's called the superficial fascial system. I use permanent sutures. Some people don't use permanent. It doesn't matter. Those at 4 weeks, they're still there. And you can get, and that's usually along the incision line. Okay. If you move funny, you'll kind of really pull one of those big sutures that are holding everything together, and it hurts like hell. So that's a possibility too. Also, there's nerves that run down from your hip to your groin, near your pubic hair area, which is called the pubic symphysis area, whatever. But they run down, and those sutures can be close to that, can be around it. And when you move funny, it can kind of
bump it.
Bump the nerve, or stretch the nerve, or tighten the nerve, or squeeze the nerve, and you can feel that shooting down into your inner thigh. So there's a lot of different reasons you would have kind of shooting sharp pain at 3 to 4 weeks, not just healing.
Yeah, but they're usually, and like she said, they're little sharp, little pains. Like they are transient, right? You get a little spike, a little zinger, a little tingly, and it goes away. It's not like you all of a sudden at 3 to 4 weeks are going to be in like crazy pain all the time. Like it's just these little pains.
Right.
Yeah. Belly button to incision numbness. Your stomach will be numb from your belly button to the incision and will likely stay numb permanently. Well,
I don't know about
maybe.
that.
It is strange. It bothered me in the beginning, but I get used to it. And there are still sometimes when it feels strange. I'm 1 year out. How long does it take a nerve to regrow?
Nils,
What
this
is
is
the
your answer.
Right?
Come on.
The rate of regrowth?
A millimeter a day.
The way to go, Nils.
Very good. Yes.
For
Nils?
500, please.
Yes.
Yeah.
Yeah, so it can take a really long time. And
Every answer Nils is going to give is a millimeter a day. It doesn't matter what we ask him.
millimeter a day.
And seaweed. Those are my two.
It's seaweed.
Need that iodine. Or Brazil nuts.
Yeah.
One or the other.
I'm sorry, sir. It's Brazilian. Throwback.
Throwback.
That's okay.
But you do eventually get used to it. And yes, if you listen to our episode about numbness, again, come with me on the Magic School Bus where we talk about numbness. It can happen. You can have areas that do have a permanent kind of different sensation. It's like you can feel it, but you can't. So it's not like it's dead numb. It's just different.
Yeah.
And that can linger for a long time. And it's possible at a year that you can still get it back. So random Redditor.
Most people get a lot of sensation back. They might have little areas that are quote unquote numb.
Right on the incision.
But that's, at least in even for full tummy tucks, extended tummy tucks, they get the sensation back. Maybe not fully, but they get some sensation back.
Yeah. It's usually, there's some. Bruising, swelling, and pain from lipo.
Yeah.
Bruising, swelling, and pain hurts 100 times more than your stitches or abs.
Thank you.
Yes.
We tell patients this all the time.
Lipo hurts more than anything we do, and no one believes us.
No one ever believes us. We say it. We're like, look, this is going to hurt way more. They're like, no,
We'll
you're
do
not
it.
right. You don't know what you're talking about,
We'll
sir.
do a tiny bit of lipo for a fat transfer on a facelift, and they'll be like, oh my gosh, my
goodness.
stomach. Like,
The
what did he
lipo.
do? I feel like he
Why
by
did
a
I
truck.
choose to do it?
Yes. Lipo hurts.
It
and
hurts really bad.
Hurts for a long time, and you will be bruised and very swollen from
But-
lipo.
Once you get through it and you don't have pain anymore and you don't have swelling, you're going to love the results.
Oh, yeah.
So you're not going to regret it, but that causes more pain than a tummy tuck does.
Yes.
Now, diastasis repair definitely causes pain,
Not like lipo.
but
It's a
not
different
like
kind of
lipo.
pain.
Yeah, it's a different kind of pain. And that's where like the muscle relaxants can really help.
Yeah. That's what I love. Pain in the butt. To add to the back pain, your butt pain. Sitting around and laying in a chair or on the couch makes your butt so sore. I'm 3 weeks post-op and I'm still on the couch to prevent myself from rolling over or stretching out too far. I wake up with butt soreness throughout the evening.
Yeah.
So from sleeping in a semi-upright position.
Have you guys ever had like New Year's Day where you sit down all day and you watch like movies and stuff? By the end of the day, like your saddle hurts so bad. You know exactly what this patient's talking about, but you're doing that for 3 weeks straight.
Well, and if you have lipo, especially on your sides, like it's not even comfortable to kind of list onto your side. So like you are just putting pressure right on those bones and right on that, right on that butt. So yes, try and change up your position as much as possible, but you will be in positions you're not used to prior to surgery for a few weeks. Yeah. Some more numbness.
Lower back pain and numb belly.
Numb belly.
Yeah. And lower back pain is pretty much universal too.
Yeah. Let me read it first.
Yeah.
Lower back pain during recovery. It was more painful than any healing. And I hated the binder. Yep. But you end up wearing compression for months because it's comforting. See?
Yes.
I'm 6 months post-op and have a long day. It's still nice to put the faja or compression on at the end of the day, right? It feels good.
Yeah.
Oh, and my entire belly is numb. Doc said it can take a year for the feeling to come back. It's weird, but you get used to it. Yeah, people hate compression until it's gone, and then they're like, "Oh, can I keep it?" Like, I liked that. Like, I thought I hated it, but I like it. And the binder, the first couple weeks is usually just for our patients until their drains come out. But then you can wear like smooth, like stretchy compression, and people usually really love that because it feels, it's like swaddling a baby. Just helps.
Yeah, I mean, pressure on areas of discomfort can really be helpful. Constant, like not strong pressure. And so that's known. And what it does is blunts that pain response. Also, that feeling of edema or swelling after liposuction or tummy tuck can be really uncomfortable. And having some constriction there that's universal throughout the area of treatment makes a big difference too. So we always go back to the same story, and Amy's like, yeah. But we had this patient who was like 2 years out from a body contouring case who was still wearing her compression garment because she was an athlete.
She had me order that specifically for her. Yeah, she was a triathlete. She did Ironman triathlons, so full distance Ironman triathlons. And she loved her compression so much, the compression that we ordered, that she asked if I could order one that was full legs.
Yeah.
And she would wear it after she did her really, like her brick workouts where she was doing like really long duration workouts, like 5, 6, 7 hours. She'd put on, she's like, there's nothing better for recovery. I mean, compression is great for recovery.
Exactly.
It just is.
Which I thought that was just so interesting, but like this reinforces why compression is helpful.
Yeah. Athletes use sequential compression leggings. Like, yes.
So for any patient listening right now who's had this surgery and maybe has some results they don't like, and the doctor said to them, well, you didn't wear your compression
enough. That's complete BS. Okay. Yeah. We have busted that myth. Go back to our myth busting episode because we have busted that myth. If your doctor blames your compression usage on your surgery outcome, well, then why didn't you just wear compression and not need a tummy tuck? I mean, if compression could fix it, right? I'll just put these leggings on. I don't need a thigh lift. I mean, yeah, that's not real. But wearing ill-fitting compression or too tight of compression can have a negative side effect. So definitely don't do that. I loved these.
Very good.
Yeah. So any other comments on any of these questions?
No, it's awesome.
Okay. So the next slide. I love this. Pooping will be a challenge. So there's a couple reasons for this. And these people both really stated it well. You will not poop normally for at least a week. You won't be able to flex your abs, period. And you will be severely constipated from surgery and pain meds. Trust me. Take the milk of magnesia as directed on time before you feel terrible. Soft foods, plenty of water.
Yep.
Yeah. So it feels like you lose that little bit of mind-muscle connection in those, because those muscles feel numb, but it also hurts and you're also afraid. So people don't want to bear down. It hurts to bear down. You're constipated from the pain meds. You're not eating your normal diet. You're maybe not eating enough so that there's not enough food volume. So there's really not a lot of food volume to help push it through. There's a lot of things that go into this.
Yeah, and the opioids are a big part of this. Yeah. People know that pain medications make you nauseous, right? But they don't know sometimes why. Well, number one, it triggers a part in your brain that causes nausea, but it's also just slowing of your digestion. But they don't correlate that with the lower part too. So if it's working on your stomach, not allowing your stomach to empty its gastric contents, it doesn't
slows peristalsis.
It's the same thing down below, right? So if everything slows down, then your colon doesn't work as well, and then you get stopped up, and that's a disaster. Milk of magnesia is interesting. We try different things besides that, but some prokinetic agent, something that's a stool softener too. All these different things are very helpful. What's the to you?
Yeah, so people want to take a lot of stool softeners after surgery, which is fine. But the issue with the constipation you have after surgery, as Dr. Martin stated, is not necessarily related to hard
That's
bowels.
What I was getting at. Yeah.
It's that you have the peristalsis. So your intestines function like an inchworm.
Yeah.
Right. So that's what moves things through. Well, that slows way down. So nothing's moving. So we usually like people to do like a tea. It's called Smooth Move. It increases peristalsis. Mm-hmm. So it can cause a little bit of cramping because it's forcing that movement of the intestines.
Right.
But if you are still taking pain meds, you can take all the stool softeners you want. It's probably not going to do a whole lot. Rather than like a milk of magnesia, what I would recommend is doing the Smooth Move tea in addition with a little bit of Miralax, because it's going to help draw water into the stool so that you get enough volume to push everything through, which is what she said about drinking water, which is so key.
Yep. And your food choices do make a difference.
They do. Yeah. Were you going to say something else?
I just got a question. I got a layman Nils question. I hear that like Ozempic and drugs like that, part of the way they work is slowing down that whole system. That's the way they work.
Yeah, well,
they delay gastric emptying.
Gotcha.
So it keeps the food in your stomach longer.
GLP agonist. And actually, like, it's interesting because Ozempic is one agonist and Mounjaro is 2, and that's why it works a little bit better. But
it's semaglutide and tirzepatide.
Yeah. But the overall clinical effect that people feel is nausea and lack of gastric emptying. And that's what all these surgeries do. They make this, I mean, if you talk about weight loss surgery, it makes your stomach smaller. So you feel full quicker and you feel nauseous if you overeat. And so this is doing it like medically or chemically speaking. So you're not narrowing down the stomach. You're just making your stomach not work as well.
One of the side effects is extreme constipation.
Well, I could see a connection between people who are on those drugs, losing a lot of weight, and then needing plastic surgery for lax skin and stuff like that. Is that like a double down if you've had surgery? And
we actually have them stop at 2 to 3 weeks beforehand.
Okay, so you have to be
totally you have to be off of that.
Right.
And that's for anesthesia.
But that's for anesthesia because it works throughout.
Yeah.
If your stomach contents aren't emptying quickly and you have anesthesia, you have a risk of throwing up and having aspiration, which can cause
that's
pneumonia.
Why you have to clean yourself out before surgery, like any elective surgery, even colonoscopy.
That's why you do an NPO or
all
don't
that.
eat.
They make you flush your whole system. So,
interesting. That's a very good question because people on these medications, which a lot of people now don't realize that you can put yourself at risk for surgery. It has to be stopped, I mean, at least 2 weeks, preferably 3 weeks beforehand.
Yeah, and you wouldn't want to start it back up again until your bowels were functioning normally after surgery. So at least a week.
Nels with a great question. Nelson.
Yeah. So the other comment on this was you can't poop for a week and the first time hurts like hell. You will have terrible back pain, which could also come from constipation. You will swell up like a box of juice, and if there is a hole somewhere, the fluid will get out. She means like from lipo. I had to read this twice. I'm like, oh my gosh, like a box of juice, and that's so true. Like we literally have patients who they'll stand up after lipo, and it is like you're squeezing the Capri Sun. It's like a stream of fluid like squeezes out.
So every now and then in the post-op recovery, I'll get a call from the nurse,
like she's leaking.
She is bleeding out from her back. It's gushing out. I'm like, it's okay. It's just the tumescent fluid we put in there. And they're like, are you sure, doctor? I'm like, I'm real sure because it happens all the time.
Yeah. And some people leak a lot and some people don't leak at all. And that's partially just how your body, how quickly it's able to process all that fluid.
Yeah.
I mean, you think about it, if you've had a tummy tuck also and you had liposuction, you had an IV for an extended period of time. So you were already filled with like a lot of excess fluid. And then yes, if there is a little hole where we went in and did the lipo and you stand up, that fluid is going to gush out like you're squeezing a juice box. I loved this. I laughed. I loved it.
So in like medicine, we talk about third spacing with any kind of injury. And as we've talked about many times before, your body doesn't know that a tummy tuck is scheduled.
It just knows injury.
It just knows it's injured. And third spacing happens with inflammation. And so the fluid goes outside your vessels into the soft tissues. Mm-hmm. And it takes a while for your body to reabsorb that.
It's like a sponge that's been saturated.
And then on top of that, you have soft tissue injury from the liposuction or the tummy tuck. So you're even more swelling. And so edema with a tummy tuck or liposuction is the main issue afterwards, besides pain. Mm-hmm. And that's where the swell hell comes from.
Yes. I did not look for a specific Reddit for swell hell, but I'm sure one exists. There's
a Facebook group.
I was concerned about what I was going to find. So
yeah.
All right. So these were great because people had some really good advice also. And I put these in the category of Dr. Martin and Amy approved recovery tips. One of which I tell this to all of our patients: undershirts or compression garments, get some tight fitting thin undershirts to wear, like either for your compression or to wear under your binder. I tell all of our patients that's the very first thing I tell them after surgery. Take the binder off, put a shirt on underneath it, and then put the binder back over it.
More like a workout shirt that has that kind of material?
Not initially. I mean, it could just be a cami because that binder it's that thick, rough, and it just starts when your skin's already so sensitive and you're swollen, and then you've got this like thick elastic band that's like digging in. You put a shirt on underneath it and then put the binder over it, and it just like it feels so much better.
Sure.
And it keeps it from slipping and sliding all over the place. But after that, yes, like we love like the Under Armour style or Nike Heat gear, just like smooth compression feels really good.
Yeah.
Yeah. I'll let you do the next one.
Make a medical chart. So make a medication chart ahead of time. I had antibiotics, pain meds, vitamins, blah, 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 blah.
Blah, blah, blah.
If you have all this set up, it's so helpful for anyone and who's helping you in the first few days after surgery.
So key.
So, and we talked about this in breast augmentation where you have a recovery station. I think that's so important.
Oh, the tummy tuck for sure.
Like a tummy tuck. So a breast aug has the same kind of restrictions or similar. You can't lift your arms over your elbows over your shoulders with a breast augmentation. For a tummy tuck, you really can't move around that well.
You're not bending over a whole lot.
You're not reaching high. Mm-mm. You can't extend out. So a recovery station is really, really smart.
Well, and it is so important. If you have multiple people taking care of you, you absolutely need to make sure that the next person that comes in knows when you had, your medications, your mineral, your antibiotics, all that stuff, because they don't know, and having them try to track it down, and like, you're in pain, you don't know.
They're counting the pills, trying to do the number of days.
Like, how many do you have left?
Right. And maybe you're not thinking straight because you're on, pain medication. Yeah. By the way, we try to get people off pain medication as quickly as possible.
It's just, you feel so much better.
Yeah.
Yeah, they really do. But even things like your vitamins, like some of your vitamins you don't want to be doubling up on.
Right.
So you can have some people, it affects them more. Anesthesia can give people some weird amnesia effects for even a couple of days. So writing it down even for yourself is a really good idea. Like, so smart.
Surgical drain output is really important for the doctor too and their staff, because if it's super high, they may be concerned. Also, if it's lower, then maybe it meets the criteria for removal.
Yeah. Keep good records. I mean, you'll never be sad that you wrote it down. Like, I always tell that whenever we get a new assistant, I'm like, just write down. I'm like, I don't even care. Like, put every word they say in the appointment notes, and she will sometimes. You see the notes that Catherine puts in.
Yeah, no, but no. Even
but our
it's
never
MA,
bad.
No, but our MA does the same thing too, and it's like literally a court reporter, on there, and it's actually very helpful because sometimes I'll read through it. And I'm like, oh, I didn't hear this. Right. From the patient, she was having this kind of discomfort or whatever.
Right. Or this happened and it's exciting. Yeah. So you'll never be sad you wrote it down. And then, you just shred it at the end. Like, it's fine. Or put it in your phone. Just delete it. All right. Those were very good and very Dr. Martin and Amy approved.
Yeah.
Let's take a quick break. And when we come back, it gets spicy.
We're going to get on Reddit.
There's some stuff you did not see coming up. And we're back. And I told you there's some good stuff coming, and there's some good stuff coming. So
we need to put like an NR17 rating on this.
Well, actually, our podcast does say that it's for adults. So It already does. All right. So let's talk about some things you probably didn't expect for 5,000, Alex. So I'm going to read the bolded parts, then we'll go back and read each comment.
Okay.
So the things you probably didn't expect: swelling and body dysmorphia, mental health and illness, don't overdo it, when will the swelling end?
Oh, we hear that a lot.
How to avoid sneezing, post-op swelling, and fatigue. So, Dr. Ryan, these first two really go together. So I'm 5 months post-op, love my results. So that's great. My recovery was unremarkable. No pain meds and no one at home to help.
Perfect.
But mentally tortured myself.
Yeah.
The swelling took me by surprise, and my flawed image of myself made some days unbearable.
Yeah, it's crazy. So we'll do tummy tucks. And you're looking at them and it's an amazing result, but they're swollen and they'll still think they're fat or something.
Well, people see the scar and it freaks them out.
Yeah, or see the scar and their mind, they're not able to work through that. Right. A lot of previous trauma comes up, or maybe it's just their anxiety.
Oh, and you're bruised, you're leaking like a juice box.
True body dysmorphia is very difficult, but like, people have kind of a mild body dysmorphia. I mean, maybe all of us do, where you're just super critical. And it's hard for them to get past that.
Well, and recovery, even when you're doing really well and not on pain meds, recovery is still fatiguing. Dr. Martin mentioned it already. Your body doesn't know you had surgery. Your body just knows that you're injured and you're needing to heal. And especially if you're feeling good, you don't tend to give yourself the grace you need to recover.
Right.
So you overdo it, or you think you should be able to do more, or you think you're feeling fine, and why can't I do this? And like, you can go down a hole in a hurry.
And then with the opioid dopamine dump, and a lot of doctors push opioids on patients, and then they waste all their dopamine in their brain. They have pre-existing mental illness, maybe a baseline mild depression or anxiety, and then they have
opioids.
Their brain is wrecked, and then also they're swollen. They look weird. They have a long scar. No one in their family is helping them.
Or everyone's helping them, and that makes them feel guilty.
Or then they feel guilty about that. And then you see this thing start to spiral. And so a lot of times in our office, Amy and I will kind of cross the threshold a little bit. You got to stay professional, but you'll like put your arm around them. You'll say, we're here.
Well, and we'll say what you're feeling is valid.
And you'll say, it's okay. This is normal. Yeah. This, like, the way you're feeling right now is probably the way you should feel. This is not different. And I think that definitely helps. So they feel like they're not alone in this. And then you have to kind of work through it a little bit.
Yeah, and the next comment was actually a follow-up to what the first commenter said. She said, if you have body dysmorphia, if you've had rapid weight loss and hated yourself before surgery, you will suffer with depression or mental health issues. Yeah, like all of us do on some level. Plastic surgery won't fix you.
No.
That is correct. It won't. We have an episode on that. If you It won't make you suddenly love yourself. It won't give you the confidence you've always desired and searched for. Arguably, it can make all these things far worse. Yes, it can.
We presented that too.
Be prepared for that. Accept the fact that you are going to be hard on yourself or even resent things, or on the flip side, and hopefully work on mental health and body dysmorphia before you get this type of surgery. Mm-hmm. She is so right. We, especially when we're paying money for something, we've worked hard for it. It costs a lot. It's a financial investment. It's a time investment. It's an everything investment. You put so much pressure on it.
It's a life sacrifice.
Right. You put so much pressure on it to fix you or to make it perfect or this is going to be the thing that does this. When in reality, this is the thing that does this. This is the thing that gives you a tummy tuck. It does not make you love yourself if you don't already. And if you already struggle, like she said, especially people who have had rapid weight loss and maybe haven't adjusted to their body yet, and then you're doing surgery, which is why we make patients who've had gastric bypass or any of those massive weight loss, we like them to wait a year. Because it takes time to kind of get used to your body again and for your body to kind of balance out.
Well, there's a medical reason for that too, because the plateau area.
Yep.
You want to make sure they stabilize.
Yeah. So they are absolutely correct. Like, surgery will not fix the mental part of you, but it can in some cases make it easier to work through, but it can also make it harder.
So the patients we have who are not body dysmorphic, but have elements of that.
Let's just say none of us have the ability to be objective about our own
People
body.
that are hypercritical of their own bodies when they just start with, and say they've lost 100 pounds, we'll have real conversations with them beforehand and say, look, you're not going to be able to probably process this change. You're not going to be able to look at yourself realistically.
Well, and you really don't know what you're going to look like.
And positive, yeah. So we prepare them already. We're like, look, it's okay. Just get ready for this. And we're going to be here. We're going to be your support system along with your family and friends and, at home. And it's going to take a couple months before we can get back on that horse and start feeling pretty good. I think when you scope it in like that for people, it's helpful. A lot of times they don't say that. These offices, you go in, they'll be like, this is the biggest transformation ever. It's going to be the greatest thing ever. You're the best thing ever.
Well, it doesn't mean that that's not true.
Well, but I don't think it's helpful to the patient personally. I think they're trying to rah-rah them through it. And sometimes rah-rah is not what you need. Sometimes you just need someone to sit there with you and say, I understand. I totally get how you're feeling right at this moment. And it will get better. There is a light. There is a North Star we're going toward. It's going to take a little bit of time.
Well, and that there's maybe more work than your surgeon's scalpel that needs to be done.
Right.
So your surgeon can say all those things to you, but if what you have is deeper than that, like surgeries, again, don't rely on your plastic surgeon to be your mental health advisor if that's what you really need.
Yeah, I know a lot of plastic surgeons. I would not rely on them on emotional help.
Right.
I mean, I'm probably the best of the worst.
Yeah.
Okay?
Well, but
I have no patience. I have a lot of empathy and no patience. So
but find your expert.
I can give you 10 minutes of love.
That's my point, though. Like, find your expert.
Yeah.
Like, you found an expert who did excellent surgery on you. Great. You fixed that. Awesome. Like, now dig into whatever is deeper.
Yeah. Now go into the next thing.
Yeah.
That's what life's about, too.
Yeah.
And support groups are great, too. Just like Reddit, like this, our podcast, of course. Yeah. And, the Swell Hell Facebook.
Find your tribe.
Like, when you have other people who are going through it, you're just with grief and everything else.
Totally agree.
That makes such a big difference to understand you're not alone.
I totally agree.
What you're feeling. Yeah.
Yeah. Someone else gets it. So, when will the swelling end? Swelling takes months, not days, to go away. That is correct.
It feels like Game of Thrones winter is coming with swelling, Like
swelling is coming.
It's just always there. It's like, wait, how winter's coming still? More winter, more winter. Swelling's like that. And it's with tummy tucks, you're not going to be on the beach in a month and a half.
Well, you can be, but you'll be swollen.
You'll be swollen.
Yeah.
You'll probably look better than you did baseline, but you're still going to be swollen.
Yeah. And that swelling, a lot of it, especially what's frustrating, is because as you get months out from surgery, like let's say you're 6-8 months out from surgery, and you suddenly eat a very salty meal, or you go on a vacation, like you're like, oh my gosh, I undid everything. I'm super.
We've had a few of those phone calls,
but you didn't. You're just swollen, and that
it was the margarita and the chili rellenos you ate.
Yes, it's going to go away. Like, give it a day.
It's okay.
Yep. But it can be...
Walk it off.
That's the other thing, too. Like, going back to kind of the body dysmorphia part of it, like, you've done all this and you're like, wow, I look perfect. And then like, oh, no, I've messed it up. And I've gotten those comments before on our podcast where people are like, did I screw everything up? Like, no, you didn't. You didn't screw everything up. Like, you're fine. Like, just give it a couple days. The swelling will go down. But it's frustrating. And it takes months to go away, not days. Not days. There was another comment on this same thread that said something like one up this, or you give it the thumbs up so it goes up higher so that I can stop seeing all of these people complaining about being swollen 5 days post-op. I was like, yes. Yeah. So,
the way they rearranged the,
right. To get it to go up higher.
That's so funny.
Yeah. I loved it.
That's great.
Let's talk about avoiding sneezing, and then the bottom two kind of go together. So tip on how to avoid sneezing. I never had a cough. Oh. One of our patients was here. She had a rhinoplasty last week. I heard a sneeze on Wednesday and I was like, oh my gosh, was that her? I ran in there and it was her. I'm like, did you just sneeze? She's like, I did. I'm like, are you okay? She's like, yeah, I am. She's like, she was kind of like tearing up a little bit. I'm like, like I get it. But with a tummy tuck, as Dr. Martin mentioned earlier, it's kind of the same thing. But I did sneeze once or twice a few days after surgery and it was not pleasant. A little tip is to rub your tongue on the top of your mouth hard and it will stop you from sneezing.
Oh, that's a good trick.
I've heard that with like when you have brain freeze too.
Yeah.
This is important because it's not fun to sneeze. If you have to cough or can't stop that sneeze, put pressure with both hands on your stomach and incision and it does help.
So in surgery, you have mask on, right? And inherently, like if you're not sick, but sometimes you just sneeze, something like triggers that sneezing stimulus. And it is the worst to sneeze into a mask. So you're always like holding the sneeze back, but I might try the tongue on the roof of the mouth trick.
Oh, what's worse is when you're wearing a mask and your nose is just running.
Oh, yeah.
Oh, and it's just filling the mask.
Yeah.
Ugh. So yeah, that's what I tell patients to do. Like if you cough, if you sneeze, like just put your brace with your hands on your stomach and it does help. So,
do you guys have any tricks for not sneezing that like you learned as
look
a
up.
kid?
I always heard that one, like you look at a bright light.
I always hear if you look at the sun, it makes you sneeze. If you say bananas, 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 it keeps you from sneezing.
That kind of makes me want to sneeze. Nell, saying bananas.
I don't know what that is, but yeah, I learned that in elementary school.
Hello. Okay, so let's talk about these next two are not overdoing it and also fatigue. So this one, don't overdo it. The anesthesia and medication will make you think that you can do more than you can.
Oh, yeah.
Oh, yes, they will. I had a patient call me after surgery in extreme pain because they had to shovel their walk by a certain time or get fined by the city. So what did they tell me they did? They took Percocet and went out and shoveled it, and now they were in extreme pain. I'm like, and they wanted more pain meds. I'm like, no. This person says, I almost walked to the bathroom by myself on day 3, and I would have for sure fallen and hurt myself and torn something.
Yeah.
You can't do it. Trust me. Make sure you tell yourself, I can't do that. Don't try. I waited and had to have help, so I was glad I didn't try it by myself.
So tummy tucks definitely take a little more anesthesia than average because you're working on the abdominal muscles and the liposuction is very stimulating. So you're going to have some residual anesthesia stuff afterwards.
Well, and your legs can feel kind of numb. Like that numbing effect can kind of be in your legs too.
A lot of us use long-acting local with tummy tucks, something called Exparil, liposomal, bupivacaine, and that can last a couple days. I know I had a hernia repair and I was feeling great for like 2 days. And then the third day hit and it felt like a bomb had gone off in my hernia repair area. And that's when the Exparil wore off. So a lot of times this like kind of local that's there will make you feel like you can do more than you can. You're not thinking straight because of the anesthesia. And then you take pain medications. And as Amy like correctly says, she's like the best person to talk to about this. It's not getting rid of your pain. Mm-hmm. It's just masking your brain. You're just like impairing yourself. So you're like, I'm great. This is great. I'm kind of a little bit full of pain meds and I can do whatever I want. And you can't. You're going to regret it.
Well, before you interrupt me, the last sentence was saying that when you feel minimal pain between days 1 and 3, it's because of the medication.
Oh, yeah.
And you think you can walk or lift something. Don't try. Tell yourself soon, but not yet.
You can always interrupt me back if it's such a problem for me interrupting you.
No, that's what I was saying. It isn't. But it was just funny because you said exactly what she said.
Oh, she and I are tied together.
That's why I was saying it was just so funny that you interrupted right before I was going to say what she said. You said,
exactly.
Yeah, you had no idea that was coming.
I actually did this. Thing. I did on my hernia repair day. I called.
You came into work the next day. I was like, "What are you doing here? Like, go home." You're like, "I feel great.
I feel good.
I feel great.
No problems. No problems at all." No, that wasn't good.
Exactly. That's what she's saying. Like those days 1 to 3, it's just so funny.
Post-op swelling and fatigue. I think we've probably covered that. But
this one was interesting because people think that like they should be not feeling tired. She said, I'm super thrilled with the outcome for the most part. However, I'm still getting worn out so much easier post-surgery. I still swell too and only comfortable if I have on some sort of compression garment. I've tried to go a day with just cute panties, no compression, and I regret it within a couple of hours. It's like, yes, like compression feels good. And if it's still feeling good, don't stop wearing it. Like there's no point. And you will feel tired. I mean, again, surgery, especially a tummy tuck, that's a lot of incisional area to heal. Could be a lot of liposuction area to heal. Yeah. Maybe you had a breast lift or something else also. Like you're going to feel tired for weeks. like more tired than you usually
And you can
do.
wear cute underwear in the future.
Put them over the compression.
Yeah.
We've had patients do that. They look like Superman.
Or just wear it later. Yeah, it's fine.
They come in full on Superman. It's like the funniest thing ever. I'm like, wearing underwear over your garment. Like, okay.
Really?
Yeah, because the garment has an opening, right? So you don't have to take it up and down to go to the bathroom.
Yeah, okay.
And some people just really don't like that feeling of not having anything, on the undercarriage.
Gotcha. Okay.
So put on underwear over it.
Yeah.
Underwear over.
Over underwear.
All right, so now we're going to get to the really spicy slide.
What's your over under?
Roger.
That's showing our age. Yeah.
Yeah. Put in the airplane reference here. What the reggae? We had that in our questions from listeners.
Yeah.
Or jive. I speak jive. Stewardess. I speak jive. All right. Something you really didn't expect.
Yes, okay. That does not work now. None of half the jokes are there.
They are. No.
Would they
more than half?
Yeah.
But it never stopped being funny.
No.
Pick the wrong day to stop sniffing glue. Oh boy. All right. So
the woman's just having a panic attack and everyone's hitting her in the face.
Yes.
And then the nun comes up and slaps her.
Oh yeah. So many things in airplane that are just would never make it today. All right. Something you really didn't expect. Improved sex life. Sex is so much better. Like 1,000 exclamation points. I can't believe it. Great unexpected benefit. Sorry if TMI, but I'm having the best orgasms of my life. This comes up all the time. For people they'll either have pain when they first have an orgasm after surgery and they'll be worried that they're doing something wrong, or everything is a lot better. And part of that is because, we're not only lifting the mons up, which could essentially allow your clitoral region to be more accessible.
That's what I was thinking.
And have more friction.
Yeah. Because the fupa, whatever people refer to when the things droop down, when you pull that up, it not only pulls the pubic hair area, but it pulls up the clitoral hood, right? So you get more exposure of everything.
Yep, more exposure, more stimulation, but also that ability for your like the pressure on your abdominal wall. Like if you have a severe diastasis, it's just allowing that contraction to be harder, more intense.
Exactly. You get more stability in your core, and then that should translate down to the pelvic floor. So it kind of makes sense.
Yeah.
Just be honest, though. There's another part of this, which is your brain, your mind.
Right. You're feeling good.
You're feeling good. You're whatever. And we don't talk about positional things with people, but like
Reddit does.
Yeah. Like you don't have stuff hanging over when you're in a sitting position and all this kind of stuff. So, or stuff hanging down. So you just feel tighter and better. And that
a little more liberated.
Yeah. And that has to feel empowering. And you probably maybe translates to better things physically, which is really, really good.
Yeah. And that was a lot of the follow-up comments. Like so many people chimed in on this because it is, it's something I hear all the time, and a lot of it is positional. There are things that you just didn't feel comfortable doing, or, we've had comments before where people are like embarrassed to like even take some articles of clothing off to have sex. So if that's definitely going to impact your sex life. And if you're really concerned and worried, then you're probably not going to have a great orgasm if you're thinking like, oh my gosh, can you see is my skin flap touching something? Like that's not going to allow you to relax. So yeah, I love this. And this is a comment I hear all the time.
Yeah. Like
it really is. And it is a hidden benefit.
I got to give a shout out to Sarah with the monkey covering its eyes.
See no evil. Yeah. Dr. Rain, can you think of anything else that we didn't really cover with this that people think they should know before tummy tuck?
No, I think that tummy tucks for sure. It's in a weird thing. They don't shorten your torso, but it feels like that, right?
Initially, yeah.
And so it kind of changes. It's a pretty drastic change to your contour in a 3-dimensional fashion. And one of the things I've seen is that people talk about how, number one, their clothes fit better, their current clothes, but they have to get new clothes. So it kind of changes their whole body physique in some ways. It's not just the stuff that sticks out. It's the sides and everything else. And so they feel like a new person a little bit. I find that very interesting. We don't always get that with some of our surgeries.
Yeah.
It's a new, like they're literally new.
Or they're just back to where they were before.
Yeah, I feel like new, better. So I've heard people say, I'm just responding to what people have said to me. Better. Like I feel
that's what Reddit's all about.
Yeah, like better. Yeah. Things like that. You don't always hear that. Breast reductions, usually people will say, oh, thank God I'm back where I was before all this madness started of these huge breasts.
You mean when I was 11?
Yeah, exactly. And facelifts are more like subtle changes and rejuvenation. But these tummy tucks are really drastic. It's a drastic change.
You would probably never guess the number one thing that people ask me after a tummy tuck.
I don't know.
This is literally the number one question I get.
Did he take my belly button off?
No.
Okay.
What did he do to my butt?
That's so interesting.
Yep, because it looks big, and it looks big for a couple of reasons. Yeah. Usually it's just swelling, right? Because we do lipo, but we do lipo above. So we've cleared out the area above, and then the swelling is kind of trapped down in your glutes.
Totally.
So man, those first few days after surgery, like it can look like you have like the biggest, juiciest booty ever.
Yeah.
Like that is, and people are like, no, I like, what did he put in there? Like I know something happened.
Apple bottom. Yeah.
Yep. And the swelling goes down, but those first few days, I mean, that is by far the number one question I get. What did he do to my butt? And then they're like, you sure? Like he didn't put any fat in there? I'm like, no, it's going to go back down to its normal size, but it looks bigger because your waist is smaller.
I love that they think that you would just take extra time to like
inject a bunch of fat.
That's assault. Like if you put fat in someone's butt and they didn't sign a consent form, you could go to jail for that. Yeah. Like, it is funny because like people think that, I mean, obviously you give off a certain bravado, but they think I just have carte blanche when that door closes. Like literally I can do whatever I want. You know, I could rebuild the OR at the same time. But no, we don't put fat in the butt unless you sign a consent form for it.
But it does make, I mean, it gives you more of an hourglass figure. So even somebody with kind of small glutes can definitely look like they have a little bit more of a butt just by making that waist itty bitty. Same thing. Or people, their friends will ask them if they had a breast augmentation, if it's just because their waist looks a little now. So it's like it cheats the eye a little.
Yeah.
Yeah. All right. Well, this was fun. Thank you everyone on Reddit who gave us the content for this. But it really, you covered everything so well. I'm like, well, I'm just going to literally use your comments because they were great.
And we have multiple episodes on Tummy Tuck. So if you're watching this, you're interested, go back and look at our library. We have probably at the top of my mind, I think we have at least 5 or 6.
Yeah, and the myth busting one is really good.
Yeah.
Yeah. Especially if you're considering a tummy tuck and haven't had it yet, definitely listen to that. So thank you all so much. If you are not subscribed, we'd love it if you'd subscribe. Give us a like. Leave us a comment in the comments below. We might use your comment on a future questions from listeners episode. You can also send me a text or leave me a voicemail at 303-630-9038. Dr. Wright, you used to do these like crazy like wrap-ups. I feel like you haven't done them as much anymore.
I know, but your voice is so melodic. You're like a siren. I feel like, I just hear your voice. Yeah, I know. It's just so good. You could be on radio or TV, don't you think so?
Or a podcast?
Yeah.
And you're better this year with your prep. Last year,
Much better.
You look like you were going to fall asleep in your chair a couple
times. There was a couple
times
where I thought I was going to have to resuscitate her with epinephrine.
Or
like, really has time stopped?
Yeah. Or like you blend 6 words together and
Well, I did that on the nano fat.
But no, so
I think awesome. One of the reasons I'm not doing as many of my post dialogues is because we have so much interaction now, which makes me so proud and happy, that it's almost less about what I'm saying. It's more about what other people are saying and hearing their thoughts and information.
Yeah, I agree.
And I think that my mindset's totally changed on this. We did this before. I was trying to get out as much information as we could about empowerment, education, so people would understand how to get through these surgeries safely and how to do the right thing. Now we're getting so much back to us. It's almost like we're a sounding board, sending it back out, commenting on their comments.
We're like a nerve feedback loop.
Yes.
It's less of a lecture and more of a conversation.
A conversation, yeah.
Yeah. So with all that said, we appreciate every one of you for being here, and we will see you here next time.
And then, by the way, we're going to sign off now, but I'm going to give that talk to Amy right now because she loves it when I lecture her.
I actually do.
Okay.